Hello, my name's Katie Cuming. I'm a medical doctor and I work as a consultant in public health at Brighton Hove City Council. So in the next few minutes I'm going to be talking a bit about climate change and how it can affect our health, and then a bit about, well, slightly better news, some of the things that we're already doing quite well in the city but we need to do a lot more of to maximise the impact on both our health and also climate change going forward, of course with a bit of a focus around transport and active travel. So to start, in terms of climate change and our health. So I think during the introductory session for this Climate Assembly, you've been hearing or talking quite a bit about extreme weather events. And obviously these are one of the most obvious and logical ways in which we can see that climate change does affect our health. Whether the weather events are floods or fire, droughts and water shortages, it's very obvious how in many places around the world these can affect our health immediately in terms of the emergency, but also into the longer term, so that flooded land or land affected by drought will be less good for growing food. It may mean that the people who live there end up having to leave. Certainly these extreme weather events can damage or destroy houses and homes, or again people might have to move from an area that's repeatedly affected by these extreme weather events. Sometimes in the UK it can be a little bit more difficult to understand the health impacts of climate change, but certainly over recent years, and particularly on a number of years where there were real temperature extremes affecting not just our country but other countries in Europe, we have seen increased numbers of deaths. I think most notably back in 2003 when there was a heat wave, and certainly in France there were a lot of extra deaths noted that year. As always, these things don't affect everybody equally, and we know that the risks from climate change and extreme weather fall much greater on those that are older, those that are very young, babies and young children, and also those that already have health conditions that make them a bit more vulnerable. So things like heart disease or respiratory chest problems and other health conditions. In terms of the good news, or starting to be better news, there are a number of things that we're already doing and that we can do more of. And in terms of health and climate change, what's good for climate change is also often quite good for our health when we're talking about healthy lifestyles. So in terms of physical activity and active travel, it's often said that if physical activity was a drug or a medicine, then all those pharmaceutical companies would be very much wanting to bottle it, to manufacture it, to sell it to all of us at high prices, because the effects are fantastic for both our physical and mental health. Being more physically active reduces your risk of dying early. It reduces your risk of developing cancer, heart disease, type 2 diabetes, and much, much more. We know that one of the best ways to get physically active is to introduce more active travel into your daily routine, and one of the best ways to start doing that is to walk or cycle to work. And when we look at our local statistics here in the city, the great news is that we're the fourth most active local area in the country according to the latest Public Health England statistics. And in terms of walking to work, we have a higher proportion of our local population already walking to work on at least 3 days a week than any other area in the southeast. So 1 in 3 the adults in our city already walk to work 3 times a week. So we've got a head start, but there's a lot more that we can do. In terms of other good news around healthy lifestyles and impact on climate change, in terms of our diets, one of the best things that we can do is to try and shift our diet from a more meat-focused diet to a more plant-based diet. And again, we live in a city where there's a lot of work going on. There are a lot of people who are quite focused on their diet. We've got a lot of vegetarians in the city, but for most people to make small shifts, which means that they'd be eating more vegetables daily, young and old, in all the places that we all eat, that would actually potentially start to impact on climate change in a very positive way. So although we're talking about active travel, transport, physical activity, diet and what we eat has got the potential to really make a difference too. So I think that probably in the last couple of minutes I've highlighted to you a couple of the reasons why making a few changes in the way that we live in the city can be good both for climate change and for our health through physical activity. But absolutely the most obvious way in which changes can impact on both of those areas is through air pollution. If more of us switch from travelling in vehicles to walking, cycling, or combining that with travelling on public transport, that really has the potential to improve the air quality in the city, which immediately is a good thing for our environment, for climate, but also an excellent thing for our health, because we know that poor air quality affects all of us, again, young and old, and particularly those more vulnerable groups, particularly affects those who are already affected by heart disease and problems with their chest. By making one more journey a day actively rather than getting in your car, you can really make a difference to that. So not all bad news, and the great news that health and climate both stand to benefit from what we can do. Thank you very much.